Reactive attachment disorder, RAD, is one of the few psychological disorders that can be applied to infants. Reactive attachment disorder is a condition found in children who may have had grossly negligent care and don't form healthy emotional attachments with their primary caregivers, usually their mothers, before age 5. The child must have a developmental age of at least 9 months in order to qualify for the diagnosis. Reactive attachment disorder also is diagnosable in children under the age of 18. Children and adults with RAD experience challenges when trying to connect with others and manage their emotions. Someone who has RAD will typically not seek support when they are in distress due to perceived lack of safety. Additionally, children and adults with RAD are typically withdrawn and emotionally distant from others. They usually have high vigilance and may become aggressive if they feel others are too close to them. Children affected by RAD exhibit an inability to form normal relationships with other people, as well as impaired social development and sociopathic behaviors due to the absence of secure attachment formations early in life. Another attachment disorder is disinhibited social engagement disorder. It is an attachment disorder that is diagnosable in children under the age of 18. Children who meet the clinical criteria for DSED often come from backgrounds with high levels of trauma, abuse, and neglect. Children and adults with DSED are unable to form healthy, meaningful relationships with others. Instead, a child with DSED lacks inhibition when interacting with those who are unfamiliar. This child will often be willing to leave an area with a stranger and/or will not consult with a safe adult before leaving their environment. Children who exhibit DSED are at high risk for danger due to their openness to connect with unfamiliar people. Unlike children with RAD, those with DSED appear to be extremely friendly and outgoing. They exhibit social disinhibited behavior. This means they are impulsive and can easily talk to unknown people and random strangers. However, they may have trouble forming stable or meaningful bonds with others. Children with attachment disorders require proper treatment and care. If left untreated, attachment disorders can result in mental disorders at later stages in life. If DSED goes undiagnosed, it is associated with the following issues later in life: emerging personality disorders like borderline personality disorder, behavioral disorders like ADHD, drug addiction and substance abuse.